Hello and welcome back to Educate Me MD. Today we're going to continue on the journey of a newborn who's only a few hours old. We've previously discussed delivery, the newborn exam, and the initial treatments given. And so today I want to focus on abnormal and normal measurements. I will go into uncommon depth on common topics to explain the ordinary in a new way. So please join us. I'm Dr. Sarah Soltz, a general pediatrician. I'm very excited to be back with you today. Today I want to give you some behind the scenes information about what doctors and nurses are doing when they are not in the room with you and your baby, or babies for some. According to the National Institute of Health, only about 2% of babies are born in the hospital. So I wanted to focus on the babies that are born in the hospital today, because that's the majority. Whenever I'm the doctor on service for newborns, I like to keep a list of our current patients. A list will have the obvious things like the name, gender, date of birth, parents' info, birth weight, but also extra details like head size, bilirubin level, and a new weight and bilirubin level each day. Every morning I receive a checkout from the overnight team, and whoever took care of the babies overnight will give me the information of overnight events, new deliveries, all of that. And then I look on the computer for any details that were not in checkout or new labs that might have been pending. I'll also talk to the charge nurse. There's usually one nurse who's in charge of each shift and has a good sense of what's going on, and see if there's any details I need to know, and then maybe the techs if I have specific questions about any of the vitals or labs. Next, I would go around with a team of students and residents to see each of the babies and their families. It's possible a student or resident may have already been by to check on the family, so to parents it may seem like they're getting a lot of visitors. This allows each person on the team to not only learn, but also to do their own evaluation and to help us come up with the best plan together as an entire team. So we gather information about overnight events, new questions or concerns. We also may talk to the nurse taking care of that family, see if there's any issues or if they are ready to go home. In the hospital, it's rare for babies to go home before 24 hours old. And this is because we want to make sure they've established a healthy feeding routine and that mom and baby are bonding well. We usually get a weight and bilirubin level right around 24 hours or close to that. And we do this because 24 hours is the age at which we have data to kind of say what's normal or abnormal and then going from there. In the hospitals where I work, the only families that are allowed to go home at 24 hours are first when it's not their first baby, because we know that they have some experience, when there's no issues with feeding or going to the bathroom, if it was an uncomplicated vaginal delivery, and OB has no concerns about mom. Most families stay around 48 hours, and if it was a C-section, they often stay 72 hours. So after rounds are done, we usually do any discharges or procedures that need to happen that day, and evaluate any new babies that have not been seen by a doctor yet. Lots of conversations happen with different members of the team or any specialists that need to be consulted, so it's usually constant activity. If you've listened to our prior episodes, I want to take a moment and talk about our little baby girl that we've been following since birth. Let's pretend she's a newborn on my rounds this morning. I stop by her room and both her parents are present. They say she's been doing great and is nursing every 2 to 3 hours, and in her first 24 hours she had 3 voids and 1 stool, which sounds perfect to me. She's lost a little bit of weight from her original 7 pounds and is now 6 pounds 11 ounces, which I always convert that to grams because those numbers are easier to work with than the pounds and ounces. So it goes from 3,200 grams to 3,000 grams, which is just over a 6% drop. And we'll discuss why this is important later. When I was reviewing her vital signs from the past day, I see she had a temp of 99.8 overnight. She was skin to skin with mom with a hat on and a blanket over her. So they thought that she may have gotten a little too warm. So a layer was removed, and then 30 minutes later they did a full set of vitals and everything looked normal. The temperature had come down a little to 99.2. And So no changes were made to her plan, and we will continue to allow her to follow the same routine of nursing and sleeping and get some more education from lactation and prepare for discharge tomorrow. So with this information in mind, I wanted to spend some time talking about what is normal for a baby's vital signs. We've talked about normal heart rate and respiratory rate before, so I won't focus on those too much. Temperature is an important one because a temp too high or even too low can be concerning. As a reminder, 38.7 degrees Fahrenheit or 37 degrees Celsius is considered a normal temperature. Obviously, not everybody's baseline temperature is right at that number, so we have a range of normal. And so any temperature under 97.7 or over 99.5 is considered outside of that normal range. And then my level of concern goes up if we have a temp under 96.8 degrees Fahrenheit or over 100.4, which is the true definition of a fever in a baby. So many things can cause an abnormal temperature. The first one that we often think of is an infection, but that's not always the case. Sometimes it can be environmental, like with the little story I told above that she just seemed too warm against mom, and that's because babies often cannot regulate their own temperature well. And so they need to have us help them know when they are too hot or too cold. So the studies that are done to determine a normal temp were done doing rectal temps. And this is a question I get often, do I have to do rectal temps? And that is considered the standard of care, but the quality of temporal ones that go across the forehead or axillary ones that go under the arm have improved a lot in the past number of years. So those are often accepted methods, especially as the first screening temp. And then if that's abnormal, then we could follow up with a rectal temperature if we have concerns about the accuracy of the other methods. As a side note, if you do use a rectal thermometer at home, make sure you use proper technique, make sure you've been trained to do it, and then that you label it so that you don't accidentally use that as an oral thermometer later. So some hospitals do vitals every 4 hours, and some do them twice a day if there's no concerns, so that can vary a bit. Obviously, a nurse or tech could take a temp or a full set of vitals at any time if there's any concerns. So we are always looking to see if that's something that we need to do. Once a baby is discharged, I don't recommend taking a temperature unless you have a concern. Although I do recommend having a thermometer at home, and so in that case, it could be helpful to use your thermometer once or twice and know what your baby's normal temperature is on that thermometer and to make sure you know how to use it properly. All right, so if a baby has an abnormal temperature in the hospital, we start by making an environmental change and then repeat it in 30 minutes with a full set of vitals, which would be the heart rate, the respiratory rate, a blood pressure, all of that. And just like in the cases above, that often does the trick. If the temperature is still abnormal, then I'm looking for other abnormalities like increased heart rate, breathing, color, etc. And then we make a decision if we need to do a further evaluation with lab tests or a chest x-ray or just continue to monitor and repeat again. Babies do not often show a lot of signs that they're sick. An infection like pneumonia or sepsis, if there's bacteria in the blood, can progress quickly. And so the immune systems are still really immature and just can't mount that response needed to fight it. So sometimes they don't get much of a temperature. They don't show many signs. And to parents, it may seem that the hospital is too invasive or too quick to jump to doing labs and x-rays and things like that. But it's often necessary if we don't want to miss those babies that have a real infection. So obviously some may get worked up who didn't need it, but then we also catch a lot and we'd rather catch it early in those that really do. The heart rate, respiratory rate, and blood pressure are all tied closely to the temperature and can vary in different ways depending on what disease process we're dealing with. So the combination of those different numbers can be very telling to what's going on. All right. Another vital sign that's very important, but not usually a sign of infection, is the weight. So baby's weight's one of the biggest things to watch right after birth when everything else seems to be going well. Most babies lose weight after they're born. Actually, the only ones I've seen gain weight are those that were taking a lot of formula. And this is for several reasons. One, they are not usually taking much food or liquid in yet because they need to learn how to eat. And the colostrum that mom has, the initial milk that comes out, it's super nutritious with a lot of protein and fat, but it's not a lot of liquid. Two, babies and moms often have held on to some extra fluid during pregnancy, and the hormonal shifts at birth cause a mild diuresis, which is the medical term for when we pee out extra fluid. And so if babies are pooping a lot in their first day, that can also be the third thing. And they'll lose weight from that too. So since all newborns weigh different amounts, we like to have a standard for how to know if they've lost too much weight or not. So it's easier to measure weight loss as a percent of their birth weight. In the medical field, since we're using grams, we can calculate this by, I'm going to give that calculation in just a little bit. So we don't want them to lose more than about 8 to 10% of their weight. About 5 to 7% is considered completely normal for most babies, but then once they get beyond that 10%, I start getting a little nervous that they may be getting dehydrated or there may be something else going on. Some studies do show that babies can lose 10 to 12% and still be perfectly healthy, so it's always important to treat the baby and not the number. So it's also important to measure babies the same way each day because a few grams or ounces can make a big difference, especially in the smallest babies. So that's why we weigh them fully naked and hopefully on the same scale that was used prior. Length is less important at this point because it doesn't change much in the first few days, although it can be tricky to get an accurate length because babies like to pull their legs up and squirm. And the first one at birth, they may have still been quite wet. So it's usually helpful to have a couple of measurements of length to make sure it's accurate. So most babies don't lose a lot of weight in just 24 hours after birth. They lose more over the first 3 to 5 days, and that's because that's usually when mom's milk comes in. It's pretty rare for it to come in sooner than that, although I have seen it happen, but when it starts taking longer than 4 to 5 days is often when babies may start losing too much weight and we start getting concerned. And this is also why we don't usually let moms go home right at 24 hours because their milk takes longer than that, and then we won't know if a baby's not latching well or getting enough to eat. And if they're in the hospital, we can watch their progress with daily weights until they go home and then close follow-ups after. So, and also while a mom is in the hospital, she can get help from nurses or a lactation consultant that may not be possible at home. So if a baby's weight is down, it's important to figure out why, and usually it's because they're not getting enough to eat. So mom may need to pump some and feed the extra milk from a bottle or supplement with formula in more extreme cases. I have seen a number of babies lose too much weight and end up being readmitted to the hospital to get IV fluids for dehydration and monitoring for possible infection. So even though I said earlier that weight loss is not often a sign of infection, if a baby loses too much weight and their bodies are weaker, that immune system is even more compromised and they're more susceptible to infection. So they could then develop an infection even though it's not what caused the weight loss. It's also possible that the weight loss could be from a metabolic problem. So if a baby's not gaining weight, we've shown they don't have an infection, and it's clear they're taking an inadequate amount of milk, then we need to do a couple of things to maybe follow up on the newborn screen, which is a genetic test that's usually done at 24 hours, or do some other additional testing, depending on what else might be going on. So to tie this back to our girl from the beginning, her weight was down about 6%, and I calculated it by subtracting her new weight from her prior one, and then you divide that by the original weight, and then multiply by 100. So I'll show that on a screen in case you're confused. And then the next slide is this calculation for her. The 3,200 minus the 3,000 gave us 200 grams. You put that over the original weight of 3,200, and you get the 6.25% weight loss. So, as we discussed above, that's acceptable. It's in that 5 to 7% range. Even though she is just 24 hours, I may feel like that's a little bit much so far, and I might check on her a little bit later, make sure that her feeds are still going well. She hasn't pooped a whole lot, so that's not a reason why she would have lost that much so far, but a lot of times they're just balancing out and we'll be just fine. Often I am asked how long does it take for babies to regain the weight that they lose, and a lot of them will regain it within a week. Average is 10 to 14 days, and I've seen some babies take up to 3 weeks or 21 days, especially if they're not really vigorous eaters, but it doesn't usually take longer than that. All right, so to review, today we've discussed a couple more vital parameters, including temperature and weight. We covered what's normal, when to be concerned, and what to do about it. So please, if you find these episodes helpful, hit the like button, subscribe so you know when I post new episodes, and even leave a comment so I know what you liked and what you didn't. I hope to make a lot more videos and want to continue improving as I go. Thank you for listening to Educate Me MD. I hope you've learned something today or understood it in a new way. Hope you have a wonderful day. Disclaimer. The information contained in this podcast is strictly educational, and even though I am a doctor, I am not your doctor, and you should always consult with your own healthcare team before making significant changes to your care.